right. Hello, everyone, and welcome to Take a Food's Advice. I'm Anjanette. This is my guest.
I'm Jewel. I'm back.
Yeah, Jewel is back. Jewel is a regular. We go between each other platforms, and we just whatever the topic is, we just talk about it and help each other out. So I'm doing this drug series, addiction series. So Jewel is in the healthcare industry. She's actually your title is Allied Health Specialist.
Right.
So she deals with
Yeah.
a lot of health things. She could tell you more than me, but I wanted just to get somebody on here that works in the field and has um, experience working with addictions. And so we'll take her advice and maybe it can help us, help others. But all the advice we can get on this subject is good because the pandemic that we're in with this drug and opioid crisis is terrible. And that brings me to I have a family member recently that's been in a lot of pain, but instead of giving her something for her pain, they end up giving her prednisone because the doctors are really trying not to prescribe opioids right now because the pandemic has got out of the hand and people's going they're going to street drugs instead of prescriptions to ease pain, not only pain but even depression and other things that's going on with them. So a lot of people self-medicate with these drugs. But last week we talked about drugs in the brain. So Jewel, just give us some details on your experience or what you did within the addiction field.
Okay. So, um, I used to work in a drug rehab center, and it was for people who were addicted to alcohol, prescription drugs, heroin, opioids, sex addiction. There's so many different addictions, but what we're it used to be that they said, well, alcoholism, drug addiction is a disease. Years later, they're really starting to say, yes, it is a disease. Um, it's because of a hormone in the brain that gets used to, how can I say it? A dopamine. So anytime something feels good, people want to do it over and over again. So it's just like we say a habit. You do something 21 times, it becomes a habit. But with drugs, you can do it 5 or 10 times and it becomes a habit. Some people have what we know as a gene that causes um, addiction. Everybody does it because some people can do drugs and they're not addicted. But we do know that it is a surge of of a hormone called dopamine. And there's so many different levels. You got a physical, emotional, spiritually, even mental addiction. You see, so when people are trying to get off of drugs, it causes pain. But when I heard you say something, you say that doctors don't want to prescribe, and you're right, because before COVID, people would go to the ER, but during COVID, well, it's always been an epidemic, especially the opioid epidemic. But since COVID, um, they're trying to do an outpatient thing, but the doctors are having to refer them to certain places and it's not working, which is why people are starting to use street drugs and people are selling their medications and that's a thing. That's real. So what we do know is that they prescribe what was it? It's called a buprenorphine. It's a drug that they were prescribing, but because of COVID, that's why they're not trying to do it. A lot of doctors don't want to prescribe. So it's a whole thing. It's really bigger than what people know. And so we would have to chop it up because it's so much. And because these doctors used to sign these waivers, they're not doing that anymore. And I think it was in 2000, it's the doctors would have to take a course, and it's only like an 8-hour course. You can't possibly help anyone taking an 8-hour course, you know, for a drug treat. It's a drug addiction treatment act that was passed in 2000. So doctors were taking 8-hour courses. That's not enough. And I always challenge people, just because I work in every hospital, I'm not a doctor. I am an allied health specialist. I have worked on every floor, ER, what they call step down unit, every floor you can imagine, post op, pre op, neonatal, uh, ortho, whatever floor is on the hospital, I've worked them and I've paid attention. But I always challenge that the doctors and the nurses get out of just working in the hospital. They want to mandate something. Why not mandate that medical professionals work out in the field? Like I like community nursing. That's why I'm out in the field. That's why I hear what people are saying. If you work in a hospital, I feel like you should be mandated to work in the community because you have no clue what people are going through. And
Well,
then they
how
end up
and,
in ER.
and people don't know where to go or how to even get help. You know, because the talking about the hospital, I've worked at hospitals for answering services, and a lot of our calls in the beginning were drug related calls. So they were trying, and at that time, probably like in 2000, there was pain clinics, and a lot of the
Yeah,
people that was addicted would go to these pain clinics and these pain doctors, and all of a sudden they shut down all the pain clinics, you know,
yeah,
after everybody was addicted. So now, and back then they could write prescriptions, but now for certain medication, narcotics, you have to have a paper to take to the pharmacy. So now all of this has stopped, and like these were the nurses and the healthcare workers that was working in the hospital. So now it's like people that has addiction, there's actually nowhere for them to go in the hospital. They're actually
right.
having to seek help. And like you were at a drug rehab center. But my question
Yeah.
with even with the drug rehab center is, how hard is it to get into these clinics? And what if you don't have income? Or what if you don't have insurance? How easy is it someone for someone without money to even get help from these rehab centers?
Well, that's an issue. Now, what you find is it is hard to get in because it's either one, court ordered. That's how you get in without paying.
Okay.
Two, if you listen, these clinics are 15 to $30,000 for 30 days, which is why people go for 30 days, they leave, they think they're on their way, they relapse, they come back in, and I think they can only go to certain facilities so many times before they have to send them somewhere else. And so there's a couple of places. I'm not sure where they get their funding and how they're helping people, but a lot of people end up in jail, is court ordered, and that's how they get the help. Now, I guess I could look up to see how many rehab places there are, but there's not many that will accept it for free.
I had looked up online the National Helpline and treatment referral information. It's a 24/7 service, and you actually can type in your where you live or your area code, and it gives you
Uh-huh.
the clinics that's around. But I don't know which ones you can go to free or, but one of the numbers is the 1-800-662 HELP, and that's 1-800-662-4357.
Hmm.
And you can go on that, call that number, and then they can get you help. But it's
And
all.
one is closing. I'm sorry, go ahead.
No, you go ahead, Jewel.
Okay, I was just gonna say, well, there's three drug rehabs in America, they say. The one I work in is at the university hospital, well, outside of it, but there's several. And NIH is one of these organizations. Now, they would have resources, but they also, that's another thing. They also, once you graduate from their program, you can get involved. But if you notice, most people that help with these drug and rehab centers, they end up volunteering. And that's because people can relate to someone that's been through it. I can't relate if I've never been addicted to heroin. I may be able to assist, but I can't relate. So a lot of these counselors go on to being counselors because they can assist. They live the life, they live down under, they could have been homeless, they could be working and and still addicted. Yeah, people that look professional and they've been addicted. They may call them weekend um, addicted only on the weekend. But I forget what they call themselves, but there's so many different ways. And, the fact of the matter is it does affect the brain. And there are natural homeopathic ways to reduce the pain, but it's a lot of work. And that's what we're finding out. If you don't want to put in the work, you may hit rock bottom and hopefully you survive it. And sometimes you don't.
Because even like when you do get treatment, say I've heard of something called Suboxone, that they put put them on to help with the cravings, but then don't you have to be weaned from that? You know, I
Yeah,
would imagine you can't be on that forever.
no. And so it depends because everybody's body chemistry is different. Some people need it for a short time until they get through the withdrawal. And some people, they have to transition and they may change their medication to something else. Um, yeah, it's kind of sad because some people can get through it. I guess it depends on how long. And some people go years with with sobriety and then they relapse and it may be 20 years later.
And we
you
talking
know?
about the user, but drug addiction or any type of addiction is a family affair. You know what I'm saying?
Yeah.
It's not just the addict; it's the family. Everyone suffers. So, what help can you, as a allied specialist, offer somebody that is supporting or is a loved one, a wife, a child, a mother, a father of someone addicted to drugs, because their health can suffer, their mental stability can suffer, their heart, can suffer. So, is there any help for the people that love a act?
Well, one thing is to it's that's difficult too because it depends on how they got addicted. Was it circumstantial? Was it due to a surgery and then they got addicted to drugs? But it's so many different things. Like, say, for example, one thing for certain is to get them into a safe environment, to help them to eat healthy. Because usually when you're addicted, you don't have an appetite. So you've got to help them emotionally. Sometimes there's nothing you can do except keep them safe,
But
keep them in a place.
even help for the family member. You know what I'm even help for the family member. What would you suggest? Like, okay, of course, I've had people addicted in my family, and it's been stressful for me. You know what I'm saying? It's been sleepless nights
Um,
for me. It's been
Gotcha.
me trying to help them, and in the process I'm losing myself, you know. So
Yeah.
it can affect your health as well. So what can we do? What can we do to still be able to be there and not to get sick or get suicidal or get depressed?
Yeah, you definitely have to, if you're not able to help yourself, keep yourself encouraged, you definitely have to get counseling. Some people go to AA just to learn the process. What's most important is to continue to say the serenity prayer, because that's one of the things that when you're in rehab, that that is something that they recite daily. So for the family to make sure that they're eating healthy, like, you really have to make a conscious decision that, and be aware
Yeah.
that you have to stay strong in order to be strong for them. You have to eat healthy. You have to reduce the sugar. Same thing. What people aren't understanding, and I say this all the time: eat healthy, drink water, exercise, pray. I
Yeah.
don't care what scenario you're in, our that's our body. Our body has to eat healthy. We have everything to sustain us all, but we are not listening. We're
And
just
you
going day to day.
and you saying that, it makes a lot of sense, because even while helping someone that's addicted to some substance or whatever they're addicted to, you can become addicted. You know what I'm saying? You can become addicted. Me, if I get depressed, then guess what I'm addicted to? Sugar. You know,
Sugar.
so to calm me down or to give me something I want, I just become an addict on sugar. I go get me some chocolate cake or whatever that is.
I've done that too. Just when you're stressed, we all are not perfect. We all fall short. But catch yourself. That's the thing. You just catch yourself. And once you catch yourself, sugar, okay, here's a solution. We all want something crunchy or something smooth, something that's going to satisfy us. So I'm a cruncher, so I eat popcorn. But if you like cookies and cakes and pies and that sugar
Yeah.
does what? It's cancer causing. We already know that it's not good for our body. So what you do is you have grapes around, fruits and vegetables. But if you're diabetic, you have to be careful. You can only eat certain, you can't eat. I might eat two fistfuls of grapes. But if you're diabetic, you can only have four or five. So, see, that's what I help with because you have to understand what that person is going through, if they're diabetic, if they have high blood pressure, if they have high cholesterol, then we create a regime to help that person. Meanwhile, they're still trying to keep their mind right because they're trying to deal with the fact that their loved one has fallen or whatever the case may be. So, yeah, it's a family affair, but you do have to exercise. If a person is in progress of doing better and wanting to be better and working on themselves, you can't make somebody do something unless they want to do it.
Yeah.
So in the meantime, you have to take care of yourself and you have to eat right. You have to go to therapy or find some sort of therapy or something to decompress, yoga, Pilates, breathing techniques. All of that goes hand in hand.
Yeah, that's great advice. Great advice because you can't fall apart and be there for your loved one. You both will be
Yeah,
falling
and
apart.
yeah, because you've got to, people say, oh, you're so strong, but even strong people need support. Even strong people, you got to find a spiritual confidant or someone you can trust, someone that's not hearing what you say, but they're not listening.
Yeah,
You see, people say they're listening, but they're forming an opinion based on what you said. They're not listening to what you said.
yeah,
They're listening to what they think they heard. That's not support.
yeah.
That's not support.
So with your services, do you offer um counseling as well as health advice?
What I do is, say, for example, if you're under doctor's care, then I help implement what they're doing. You get permission and say, I'd like to make some alternative choices or do preventative things first before I get on medication. Some people get on antidepressants. Some people will not touch antidepressants. Some people will do it temporarily until they're in a good space, and then they start making healthy choices. So for me, I listen to all of that. I assess all of that. And then I suggest what can be done if they're not in a doctor's care. They have to be coachable. Because one thing I can tell you, this is not a joke. When you really know in your mind that you've got to change some things, you've got to be coachable or it won't work.
What
And at least I say,
Go ahead.
I usually just say, try it for 90 days. You don't have to have unless you know that you know that you know you need somebody to uh, keep you lifted, keep you motivated, then you may get an annual. But most people start out with 90 days. Some people may only need 30 days and then they'll implement it on their own because they don't need anybody to help them or to assist. But there's people that always say, "Oh, I know, I know." Okay, you know, but then you plateau or you fall off. So you gotta pick and choose what's more important. This is the time to get in alignment,
What I like
truly.
what I like about the service that you offer is that it's for the individual, because a lot of people don't know that you do blood work with your services. So,
Right.
that helps you determine what that person actually is lacking, what that person
Right.
actually need. It's not like your services is a one size fit all.
Mm-mm. It can't because we're all different. All of our body chemistries are is different. So say for example, you go and get a physical and then you get your blood work and then the doctor doesn't call you and you call and say, well, what's going on? Oh, you're fine. You're in normal range. Really? Okay. We all have something different. And then I go get a physical and maybe let's just say your let's just say vitamin D3. Let's just say your vitamin D levels is at 90 and mine is at 100. Well, in between that, there's numbers too, depending on who you are mentally, emotionally, psychologically, where you are spiritually, where you are in your physical state. You may be 5'4" and 145 pounds. I'm 5'6" and 150 pounds. That's why we have to adjust. And when I say naturally, it's not a quick fix. We have to balance you out for your homeostasis pattern, not mine, but for yours. What makes you feel great?
Now,
And then you get your blood test.
can you use say I've just had a physical at the doctor and they did my already did my blood work, my panel. Um can you go by that panel or do you have to do your own?
No, you can submit as long as it's within, I usually say within 30 days, but it's been known if you, like if you 3 months, say 90 days, you just got a physical within 90 days, great. Some doctors want you to get a physical and they do blood work twice a year. Some people do it once a year, depending on their insurance. And if you're with a DO, which is an osteopathic doctor, saying he's an MD, but he works holistically as well. Okay. So he may do it 3 times a year. And
So
that's so that you know the values.
now your services, is it insurance or is it cash?
Yeah, a lot of us who are integrative therapy, homeopathic is out of pocket.
Okay.
I am trying to work. I think I'd like to figure it out. But one reason why a lot of people don't do Medicare, Medicaid is because they don't pay on time. They pay too slow. Like I do some and it's every 45 days. So I always, people don't realize that when you're integrative, it's best to pay out of pocket. People buy what they want to buy. But when you're in a point where your health and wellness comes first, that's when you put the money into your body. But I am working on trying to get it insurance to accept it, but that's a whole nother story.
Yeah.
So I will do sliding scale. If
Okay.
people can't afford my service, all they have to do is call and we'll figure it out. And then I also say donate. But when I say donate, they're donating $5, $10. No, ma'am.
Yeah.
we're going to have to work it out because I still have to live. My livelihood has been compromised because of COVID and because a lot of people need help, but they can't afford to pay.
Yeah.
So it just depends.
Okay. Well, Jewel, I thank you for coming on again. Where can they find you at again?
Girl, okay, simplyjewel.com. Start out there first. And then all my social platforms are on simplyjewel.com, Instagram, they're all there. And then again, the podcast and everything is at the bottom. But I will say, make sure that you look at my website on a laptop because until I can find time to funnel it down, it's a lot of information. Or just simply call me. I'm available. You can book an appointment and you do get a free hour consultation. So I'm just a phone call away. If they can't get to their doctors and call their doctors, you can call me. I can do some of the work until you can get into your doctor. By that time, we may have solved the problem.
So should they message you to get your phone number if needed? Just send you a message on your social platform and then get your number.
They can, or when you go to simplyjewel.com, you click on where it says contact. And all my information is there. My phone number is there, 720-435-0269. You can text me, you can email me, you can call, and I'm the only one that accepts my calls. So then we can move from there because everything is about, I do respect HIPAA. I do respect confidentiality. So I'm the only one that's going to get the information. I would suggest to go to simplygewel.com and fill out the form in the upper right hand corner. That way I will call you. And if it's, and if you have to, just call me, leave a message. I usually get back to people within an hour. If I take too long, just text me and say, hey, this is so and so. Please get back with me.
Okay. Well, thank you, Jewel. Thank you for your time and this episode, another series on drugs and addiction in our community, in our families. And it starts with our health, all of our health. It's a family
Yeah.
affair. So anything, any advice, any help that any of us can get with our health, it also helps with our mindset. It helps with depression.
Yeah.
It helps with you name it. When you feel good, you think better. And
Right.
when they say, what is it they say, health is wealth. So no matter what, even if you don't have insurance, if you got to pay for a service that's going to make you better, it's so worth it. Because when you think of addictions, the money that is put into addiction, I mean, and it's big money. So if you can put
Yeah.
it into that, why not put it into yourself, put it into your health, put it into your mental health, your physical health. And on that note, we always give a food advice at the end. So what would your advice be, Jewel?
Oh, my advice would be if you are struggling, the first thing to do is to admit that you're struggling and it's okay to say you need help. A lot of people don't uh, confide in the medical system because of the lack of trust. So you're welcome to call and find someone you can trust and get them to go with you. Always take someone with you so that people can document what is being said. If you are a family member that is struggling and needs support, make sure, same thing, you find a spiritual confidant or someone that you can trust and let them know what your struggles are. It is okay to some kind of get something that can help you decompress. It's okay to get therapy, but most importantly, eat healthy, drink water, and depend on your higher power. And I don't care either one, just keep speaking life into yourself
Yes.
until you get through it. And lastly, I said this before, take your right hand and put over your heart and just keep consoling yourself and keep speaking life to yourself until you find peace.
Yes.
You'll get through it.
Yes.
You will get through it.
Thank you for that. And before we go, I had looked up the national, because a lot of people are depressed during this season. So I looked up the National Suicide Prevention Line, and they have a number now that's universal all over America, and it's just
Yes.
988. That's all you
Eight,
got.
eight. That's right. That's
988.
right.
And they're 24/7. And if you're just need somebody to talk to and you don't have anybody, remember, call that 988. All
Yeah. And I'm glad that they put that out, the 988. And actually, I was really going to post that the other day and forgot to do it. So much was going on.
yeah,
But yes, if it's a life-threatening emergency, please call 988 because you can talk to us and I don't care, professionals are going through it too.
yes,
And burnout. So people are burning out. But once you eat healthy, exercise, keep your mind lifted and motivated. And if you can't, and if all else fails, please call 988.
yes. All right. So in the words of my late brother Sean Swanson, shalom, peace.
Ronald Lincoln.
All right.
Peace
Talk
and
to you
blessings.
later, Jewel. I'm gonna finish this up and I'll send it to you.
Okay, we'll talk soon.
All
Take
right.
care. Merry Christmas.
Merry Christmas.
Bye bye.
Bye bye.